Bismillahirrahmanirrahim. Assalamu alaikum everybody. My name is Dr. Minhaj Qidwai and I'm a consultant and head of quality at Karwan-e-Hayat Institute of Healthcare. Quality, the terminology is well known to us, but what it really means, that has to be explained and understood by everybody. The guru of quality, Dr. Deming, says it's a process of continuous improvement. Joseph Duran says that it's fitness for use. Phil Crosby says it's conforming to requirement. And myself as Dr. Minhaj Qidwai have coined a definition which says quality in healthcare is a process of continuous improvement which is focused on effective and efficient use of resources towards patient safety and customer satisfaction. While the American Society for Quality says the totality of features and characteristics of a product that bear on its ability to satisfy a given need. That means satisfaction of a person is important and the quality lies in the eyes of the beholder. So in that case, whatever we see, we agree, we accept, we are satisfied, that becomes the quality. So quality basically has to be seen from a client's perspective or customer's perspective. The client perspective says that quality is a standard of something as measured against other things of a similar kind. The degree of excellence of something leading to customer satisfaction. So quality has to be there, ensuring that the client or the customer is satisfied. But the quality is also served as far as the place of service, which is the hospital. So hospital also has a quality perspective, and it is a process of utilizing resources effectively, efficiently, and equitably, measuring and analyzing indicators geared towards management of patient safety and customer satisfaction. So wherever the quality is being served, the service delivery at the healthcare facility becomes very important, but the hospitals have to ensure that the patient satisfaction and satisfaction and safety is ensured. At the same time, quality has also to be ensured at the organization perspective because organization has to thrive, has to move forward in terms of development. So the organization perspective can be explained as focusing quality service by establishing processes and controls for quality assurance, hiring of competent staff, and ensuring quality physical facility and organization culture. So that means quality has three main perspectives: from the client perspective, hospital perspective, and the organization perspective. But why quality is important for us? Quality enhances customer satisfaction, quality improves efficiency and reduces cost, quality builds brand reputation, and quality ensures compliance and safety. So that's the reason why quality is important to us. And quality of care is important because it has to be safe, effective, efficient, equitable, timely, and patient-centered. And the degree to which health services for individuals and population increases the likelihood of desired health outcomes and are consistent with current professional knowledge. So we have to ensure that the quality care is taken care by all the individuals within the organization to ensure client safety. So coming at the quality at Karwan-e-Hayat, why we needed the quality department at Karwan-e-Hayat? So why do we exist as a department? Whom we serve, how we do it, and what do we have to do to ensure quality? So I'd like to share a quote from Albert Einstein which says that without charging a pattern of thought, We will not be able to solve the problems we created with our current patterns of thought. That means if we continue doing whatever we are doing, we will not be able to solve the problem. So we have to make some changes within our structure, thoughts, processes. So the need for change is there as the costs go up, there's legislation issues, there may be some health issues, there may be some innovative issues, customer needs may change, competition may force us to change, and the growth is required for change. So we need to grow, we need to have governance issues that needs to be, we also may lead us to make some changes. So all these changes have to be made, but change is not easy to be made because there's a failures that change. So activation is the responsibility of the senior management. The strategy and planning is required, and we have to make a vision for managing that change. So we have to activate, then we have to motivate people, and these include the tools that will be employed in terms of process improvement. Employees' trend has to be changed, training and capacity building will be required. So we have to motivate people, we have to energize people, and then we have to cultivate those changes by monitoring evaluation, reward and recognition, uh, awarding championships to the departments, and coaching and counseling. So activate, motivate, and cultivate the change, as the change in the culture is not easy to be made. So, starting with the foundation principles, whenever we lay down a change, we need to ensure that there are some foundation principles that lay the foundation, and in this case, I'm talking about the quality department establishment. So, the foundation principles would be in terms of the healthcare professional. Charter says that we need to ensure patient wellness and welfare, patient autonomy, and social justice. And at an individual level, we have to respect people, we have to ensure ethical principles, we have to ensure trust is there, integrity is maintained, respect of patient is there, and then altruism, doing good for everyone. So these are the foundation principles that we have developed for the establishment of the quality management department at Karwan-e-Hayat. And then once the foundation has been made, the next step is to lay down the bricks to connect all the dots. And these bricks are laid down through the role of the leadership, the governance, the competency has to be ensured in hiring staff, service delivery has to ensure quality, the physical facility of the organization has to be spick and span, and the organizational culture has to be developed in terms of developing a quality culture. And timely actions need to be taken with team and capacity building. So these bricks are laid down in terms of building the organization. And then when the bricks are laid, then we have to lay down the binding mortar, and the binding mortar is laid down by the communication process. And the important C's for communication process include commitment, cultural change, controlling the organization and environment, cooperation, and customer focus. So once these binding mortars are laid and everybody is on the same page in terms of the changes that we need to bring, the next step is the building of the roof, and that roof is built by ensuring motivation of the employees, recognizing them, and ensuring them that they yield for good for everyone. So to start the quality management, we have to inculcate the concept of total quality management within the organization. And total quality management approach is centered on quality, with a global strategy based on the participation of all the members in the organization and aimed at long-term profitability through customer satisfaction, benefits to the members of the organization and to the society. So, holistic approach to total quality management is important, and the stages of total quality management include ensuring and developing quality controls, quality assurance, quality improvement, and quality management. So that develops the total quality management concept within the organization. The important area over here is that we ensure and focus on the process improvement within the organization, developing policies, ensuring the processes are laid down, and then the training of the employees of all the organization. So the people are in congruence with the policy that are developed, and then the processes are understood by all the people, so they are followed, and then repeated training is ensured that the message is sent across throughout the organization for process improvement. So laying down a quality management department is basically ensuring that a solid building is built up with laying down the bricks, foundation, and the bricks, and then the mortar, and then the roof is built with recognizing people, motivating them. So, to summarize the steps in terms of establishing a quality management department, the foundation are laid by ensuring the integrity, ethics, altruism, trust, responsibility, and the healthcare profession charter focusing on social justice, integrity of the patient, and well-being of the patient. Then the bricks are laid by the leadership, team, training, capacity building, and the binding mortar is basically laid down through the communication, building a change, and ensuring that all the people within the organization are on the same page in terms of quality improvement. And the roof is built by motivating people, recognizing them, and ensuring that they do good and service to the employees, to the patients, and the customers is ensured. So, just to summarize the quality word in nutshell, the Q can be labeled as for total quality management, as quality is the main focus. Then U is for understanding and communication, because in communication understanding is very important. If you don't understand, you cannot convey the message properly. So understanding the others for communication is important. Then assuring them. Leadership plays an important role in this case, ensuring eye for the improvement, and which is continuous improvement, taking timely actions, and yielding for others to be served and serving others. So, to conclude this presentation, I would quote from Mr. Muhammad Yunus, which says that truly affordable but high quality healthcare tools and services are the only means by which quality healthcare can be provided to all. And all of us need to focus that what you do for yourself dies with you when you leave this world, and what you do for others lives on forever. So quality improvement has to focus on doing for others and ensuring that patient satisfaction, client satisfaction, hospital satisfaction, and the organization satisfaction is there in terms of improving quality at all the levels. Thank you very much.